All right, everybody. Thank you so much for staying with us. Welcome to the Black Mental Health Matters, excuse me. Our mission here is to encourage open dialogue around mental health among Black communities, all Black communities across the diaspora. I am your host, Cynthia Hill, and today we have special guests with us discussing the topic of barriers to mental health care for men, unraveling the challenges. Okay, let's go ahead and welcome Dr. Cloud to the show here. Thank you so much for joining us, Dr. Cloud.
Thank you
Thank
for
you for
having me.
having me.
Good
Good
morning,
morning,
everybody.
everybody.
Absolutely. Thank you so much. All right. So today, Dr. Cloud, I want to give you a little bit of an introduction. Everyone at home, a little bit of an introduction. Dr. Cloud is currently a social worker for Mecklenburg County, North Carolina, where he provides HIV and STI outreach services to the community. Dr. Cloud has been in the field of social work for over 8 years, and during his time has served in various capacities, including outpatient mental health, adult and juvenile correction facilities and services, HIV treatment centers, and the school system serving grades K through 12. Wonderful. And of course, his social media handles will be running across the the video thing here. So if you want to get in contact with him throughout this broadcast. So welcome again, Dr. Cloud. Thank you for all the wonderful work you've been doing in the community in North Carolina and how it's reverberating throughout the country as well. So thank you so much. If you'd like, we can go ahead and get into the questions today.
Yeah.
Yeah.
Okay. So everyone, again, we are talking about barriers to mental health care for Black men, and unraveling the challenges that they face in our country. And my first question here is, why do you think this topic is so important and should be discussed right now in our nation?
So
So
I
I
think
think
when we're
when
talking
we're talking
about
about
why
why
this
this
is
is
important,
important,
we
why we
need
need
to
to
discuss it
across
across
the
the nation,
nation,
is
it's
because
because
you are
you are
seeing
seeing
men
men
in the
in the
lack
lack
of
of
participation.
participation.
Uh,
Uh,
we're
we're
also
also
seeing
seeing the
the increase
increase
in
in
mental
mental
health
health
with
with
men.
men.
And
And
so
so
when we
when we
have
have
conversation
conversation
we
we
bring it
bring
to the
to the
matter,
matter,
it
it
lets
lets
who are
who are
mental
mental
health
health
professionals
professionals
to
to
better
better
understand what's
and what's
going on,
going,
how we
how
can
we
come
can
treat the
treat
condition.
Okay, wonderful. You're going in and out, so I kind of want to get that situated before we continue on. Let's try and troubleshoot this for a second, and then we'll get back into the questions. Oops, excuse me. Can you go ahead and test your mic again? Were you able to kind of?
Yeah, can
Yeah,
you hear
can you?
I'm still getting you going in and out.
me? Okay,
Okay,
I'm getting
getting
it.
it.
So,
So,
uh, all right, so I'm
so I'm
getting
getting
an
it.
echo
Um,
on
um,
Is
both.
that, yeah, the other show? I got that echo because I had the YouTube up as well. Could that be why?
It
it
could
could
be.
be.
Okay. So everyone who's still here with us, thank you so much for being here. We're still talking about this important topic while we get our technical difficulties together. But I did want to talk uh, and kind of talk to you about some studies that are out there right now, guys. That are pertaining to this topic. Here's one. A study from 2020 explored the effects of discrimination on older adults living with mental health issues, Black adults. Study results show that daily discrimination or discrimination in healthcare related situations increase someone's odds of experiencing a barrier to healthcare by 2 to 3 times. So older Black Americans, they found, are experiencing daily discrimination in healthcare related situations, and that is what's making them not go to a physician at a rate 2 to 3 times other other ethnicities, other races. So I think that is a pretty alarming number, especially if we want to really focus in on the healthcare of Black Americans and Black men in our country. Okay. We are going to discuss with our expert here, Dr. Cloud, LCSWA. We are working on some technical difficulties, so let's go ahead and see if we've got that fixed. Dr. Cloud, can we try to test your mic out again?
Yes, can you hear
Yes,
me?
can you hear me?
Yes, that sounds great. Was it the same? Was it that issue that I was talking about?
Probably
Probably
was.
was.
Okay. Great. I'm glad we got it fixed. Awesome. So let's get into our next question. And that is about diagnosing certain mental health conditions and how they are diagnosed disproportionately in our country. Unfortunately, that has been found. A study done in 2021 indicated that medical students and psychiatrists were biased in diagnosing and associating psychotic disorders and antipsychotic medications to Black clients. Dr. Cloud, let's talk about the bias in that. Where is it coming from? Are you seeing this?
So
So
when we're
when we're
talking about
talking about
diagnosis,
diagnosis,
the
the
issue
issue
comes
comes
from the
from the
DSM-5.
DSM-5.
So if anybody
So if
knows what
anybody knows what
DSM-5 is,
DSM-5
it is
is, it
our
is our
diagnostic
diagnostic
manual
manual
for
for
clinicians.
clinicians.
But the
But
thing
the
is about
thing
the
is about the
DSM-5,
DSM-5,
it's not
it's
for
not
Black
for Black
people.
people.
So the
So the
DSM-5
DSM-5
was pretty
was
much
pretty much
written by
written by
white
white
people
people
for white
for white
people.
people.
And so a
And
lot
so
of
a
the
lot of
times
the
what
times what
happens
happens
is
is
we're
we're
diagnosing these
diagnosing these
African
African
American
American
males
males
at an
at an
early
early
age.
age.
And then you'll
And then
see it
you'll
in the
see it in the
school
school
system
system
that we're
that we're
diagnosing them with
diagnosing them with
ADD,
ADD,
ADHD,
ADHD,
ODD.
ODD.
Okay.
And then when
And
they
then
return,
when
they turn
return
18,
18,
what we're
what
seeing
we're
them getting
seeing them getting
diagnosed is
diagnosed is
about as a
about as a
personality
personality
disorder.
disorder.
Because you
Because
can't
you can't
diagnose
diagnose
anybody with a
anybody with a
personality
personality
disorder to
disorder to
18.
18.
Mm.
And so what
So what
happens
happened
is
is
from the
from the
early
early
ages of
ages of
10
10
usually to
usually to
about
about
17,
17,
the school
the school
system
system
starts to
starts to
align
align
these
these
diagnoses with
diagnoses
the
with
African
the African
American
American men
or these
or these
boys,
boys,
and it
and it
follows them
follows
into
them into
adulthood.
adulthood.
Wow. Um, right. And so, and they're using the DSM to guide them. Wow, what powerful information. I hadn't looked at it that way. Yeah, it's not made for us when you think about it. So thank you for that perspective. In addition, participants were more likely to view Black people as being non-compliant when it came to treatment. Are you seeing that as well?
There's an
There's an
echo
echo
I'm giving an echo?
on my
on my
end.
end.
Oh, okay. Um, let's see. Okay, well, guys, we again are gonna work out these kinks. We actually didn't have it when we were testing earlier. We were just fine. So unsure of what that might be. Can you hear it from your computer or no?
From my
From my
computer?
computer?
Yeah.
All right. No.
No.
Okay.
Let's try that.
that way.
Yeah.
Yeah,
Early.
yeah, yeah.
Oh, now I have the echo.
All right.
Okay.
We can continue.
We can continue. I think
it's better.
it's better.
Okay. Okay, guys, thanks for standing by. Yeah, so my question was just a follow up to talking about how the DSM is not catered to Black people. So boys are getting diagnosed with ADHD much earlier on average. Is that uh, fair to assume or say?
That is
That
fair to
is
us
fair to us.
because
Okay.
what we're
Because what we're
seeing
seeing
is as
is
they get
as they get
diagnosed,
diagnosed,
boys are
boys are
hyper.
hyper.
And so
And
we
so
know
we
they're
know
being
that
hyper. We
hyper, we
start with
start
just a
with just a
2-phase
two-phase
cell
cell
with some
with
sort of
some sort of
DSM-5
DSM-5
diagnosis
diagnosis
that
that
we're going to
we're going to
be
be
kids.
kids.
But then what
But then what
happens
happens
is that as
is
they
that
get
as they get
older,
older,
they
they
become
become
act out
act
because
out
of this
because of this
hyper
hyper
behavior.
behavior.
That's when the
That's when the
diagnosis
diagnosis
comes.
comes out.
And
And
because
because
we so
we
often
so
want to
often want to
medicate
medicate
children
children
to get to the
to
root
the root
cause,
cause,
they're stuck with
they're
the
stuck with the
diagnosis.
diagnosis.
Yeah, almost like a quick fix. And I can attest to this. Two of my cousins on both sides of my family um, were diagnosed boys at a very, very young age. And it didn't go diagnosed with ADHD at a very young age. And they weren't um, from my perspective, I was a kid, but from my perspective, didn't it didn't do them well. Later on in life, things have gone awry. It did not benefit them in many many ways. So thank you for touching on that. So we did say, in addition, participants were likely to view Black people as non-compliant when it came to treatment for these things. Which, but having you having said that it's disproportionate, and us knowing from this study that it's disproportionate, to me, that's understandable. Especially if you're basically out here fighting for your life. What are your thoughts on that? Are you seeing Black people being viewed as more non-compliant in treatment?
So
So,
before I answer, let
yeah,
me
so
leave
let
a
me
lot
leave a lot.
of there's still an
There's
echo.
still an echo.
Okay. You said let you leave what?
I'm gonna
I'm
leave and
gonna
come back.
leave and come back
Okay.
To the
to
live. I'm
the
so
vibe. I'm
tired.
so tired.
Okay. The echo is still there. Oh my gosh. Okay. I don't think. Hmm. Yeah, I don't think it's me. So let me. Let's see, guys. If you're still on here, we are working on discussing the barriers to mental health care for Black men, unraveling the challenges. We are working out some echoes, okay? And we're welcoming in Dr. Cloud again. Welcome, Dr. Cloud. Thank you so much for working with us with what's happening here. Let me, on my end, I can. Oh, nope. Let's leave that alone. All right. Let's see. Are you having mic issues still, or what are you?
No.
No.
No. Okay, we're sounding great. All right, guys. Thank you so much for hanging on. I appreciate you all. Let's get into it. These are such important topics to discuss. Barriers to mental health care for Black men. Again, guys, this is Dr. Cloud, a social worker for Mecklenburg County, North Carolina, an expert in social work, working with Black men and Black boys. So we were talking about the DSM. What is it?
The DSM-5.
DSM-5.
DSM-5, and how it is not necessarily catered to and has not necessarily been created for Black people. So that becomes a barrier. We're also talking about a study that shows that students, medical students, and psychiatrists do have a bias when diagnosing or associating psychotic disorders and antipsychotic medications with Black patients. Um, I think the first time you talked about it, we kind of got a good idea. You were saying the DSM wasn't for us. Let's continue talking about uh, the view that Black people are non-compliant, more non-compliant when it comes to treatment for these medical conditions, mental health medical conditions. Your thoughts?
So what comes into this is that the reason people are non-compliant, or the reason that they have to follow like the proper protocol of treatment, is because many they're scared of the doctor. And what happens when you're scared of the doctor, when you have this, I guess what we call it, the boogeyman in the closet, is because we hear all these horror stories about when Black people go to the doctor and how they're treated, the bias, the stigmatism, the racism, and everything like that. And so it makes them scared. And then you also have to look at like prior studies as well, where African Americans have been participants in the study. But like, the Tuskegee experiment, right? That's one of the biggest one. Henrietta Lacks is another biggest one. How we're still using her cells in modern medicine and now, but her family never got recognition, I think, until like the mid 2000s for that. So it scares Black people because, one, either we're overlooked, or two, we're overdiagnosed, three, we're underdiagnosed, or four, doctors just don't really care because all they see is our skin. And so we're dealing with these, pretty much these four things, right? And so, especially when you get a white doctor, and I've seen this happen plenty of times, when we get a white doctor, we most times people don't want a white doctor because they're not listening. All they're trying to do is just treat what you're there for, versus treating the underlying condition that also may be there with it, especially in mental health, because we don't know. I'm not gonna say me, but certain those who are non-Black do not know exactly how to treat mental health for those of color, because they're going off of one treatment modality, right? They think it's a one all fits all. So what may work for your white client in a mental health episode may not work for your Black client in a mental health episode, and we don't seem to look at that sometimes.
Oh my gosh, you're so right. And then, are you seeing that? Um, Um, let's talk about now, like you were already touching on, underrepresentation in clinical trials. System barriers include issues like lack of insurance or access to quality hospitals, while individual barriers include factors like overt and implicit bias or discriminatory behaviors that healthcare professionals exhibit during patient encounters. So we've got the discrimination that's coming in, and we've got the access as well to insurance and lack of quality hospitals. So, not these are the barriers that are making Black folks, Black men, not participate in clinical trials. Can we talk more about that? Should they participate, in your opinion? And if so, what should Black men specifically know about these clinical trials so that they think it's more safe, or know that it's safer? Um, what will make them participate?
So I don't think in the regard that Black men should participate in clinical trials. And that's just from what we see in history, right? In the mistreatment of Black males in general in society. But the thing that also, and it's a catch-22 for me. We need Black men to participate in clinical trials because there are certain things that we need the data for. But I personally would never tell a Black male to participate in a clinical trial, only because when we look at, again, we can go back to the Tuskegee experiment, right? And how those Black men were in a clinical trial and they actually weren't told the truth, and how it affected their families generations later. And so, as somebody who is a Black male, and who says has that mistrust of the medical system, it's kind of hard to tell another Black male, "Oh, you should do this clinical trial." If I know myself, I won't do it. But if it's a clinical trial ran by us, for us, then that's a different story. Because then I know, now, not saying all kinfolk is skin folk, but it also can say as well that if I see a study and it's predominantly African Americans who are utilizing or running the study, then I'm more inclined to tell fellow black men this study is by us and it's for us. So I believe that the harm reduction is greater, as in there is less risk of harm than it would be in a study created by those who are white or non-black. Because I know that this data that's being utilized or the data that's being taken from the clinical trial will actually benefit us as a whole. Versus if it's a clinical trial ran by somebody who's white, I don't know where that data is going to go, and if it will actually harm us or benefit us in the same breath. And so it's kind of one of those tricky slopes because you want advancements in modern medicine and clinical trials for us, but then it's also in the same regards, you don't know exactly what may happen because again, history has shown the mistrust and the misuse and the abuse of black people. And then black men have always been on that scope as well. And so that's really where you kind of be like, I don't know if this is kind of a safe option. And I hope that answers the question because so often when we talk about clinical trials, and I've seen plenty of clinical trials, and they say, well, we need more people of color, right? Like for Duke University is holding a clinical trial now on exercise, and they're recruiting men of color. But the study is not by men of color. So what do you want to know about exercise from black men that you can't get from any other race? And so it's kind of those things that kind of like I would need more insight to make a good decision.
Wow, what a powerful explanation. I think you're exactly right. There's no one right way to go about it. And there's so much hurt and trauma that is um, associated with these clinical trials. But I did want to follow up and ask, so if you are seeing that, are you seeing any trials that are Black led?
So lately I haven't seen any trials that are black led. And the only reason why is because we don't see those trials too often. And it's only because of the area as well. So I think it depends on your geographic region, right? So for instance, if you're near John Hopkins, if you're near Duke University, if you're near one of those major hospitals, or the CDC in Atlanta, you're more than likely to see those type of clinical trials in the area. And so I haven't seen any clinical trials led by black people for black people. And not it's not saying that they're not out there, but I just know that in my research and over the last couple of months, I haven't seen any clinical trials where black people are the ones running it. And you're not going to see that too often. It's going to always be one of those rare. I call it the unicorn in the bunch because it might pop up out the blue, and then you won't see it again for a while, and then it'll pop up again, and you're like, oh, okay. But other than that,
When you do see that unicorn, are you seeing that it is from what, like HBCUs, or what kind of hospitals and experts have you seen, if you can
so if I
tell?
So if I see that type of clinical trial, what I'm seeing it from is you're correct. I'm seeing it from our predominantly black areas. So like Meharry Medical College, right, is an HBCU. And they have the School of Medicine is there, the School of Dentistry is there. And so a lot of their clinical trials or trials in general, you will see steered by the black people there, for the black people in the community. Howard University, one of my alma maters, the School of Dentistry is there. And so when there would be those dental trials, it would be geared towards people of color because they understand that people of color have one of the lowest health literacy rates in the United States, and it's usually those who are older, not those who are younger, because those who are younger now have more access to care than those who are older. Those who are older, we're going to talk about the generations who were born before us. So not our mother's generations, well, depending on how old your mom is, but our grandparents and our great grandparents, their generations.
Okay, thank you so much. So we talked about this already a little bit, going less for fear of discrimination. That's what's happening in our communities among Black men, among Black women as well. A study from 2020 explored the effects of discrimination in older Black Americans who had medical conditions. They showed that they experienced daily discrimination or some other discrimination, maybe less often in healthcare related situations, and that in turn increasing the odds of them experiencing a barrier to getting healthcare by 2 to 3 times compared to other races and ethnicities. So I think those are alarming numbers. Those are recent numbers, um, barring COVID. But I wanted to ask people, including Black men, aren't going to the doctor. So this is because of that persistent discrimination. So, as a medical professional, are you seeing this? Are you witnessing this? And talk to us about what you've seen.
So since we're predominantly talking about Black men, and that is what I predominantly see a lot of, you are correct. You would not. It is hard to get a Black man to go to the doctor. It is hard to get a Black man to go to therapy. It is hard to get a Black man to come in for the annual checkup. It is hard to get most Black men to do their prostate screening when they're over 40. It is hard for us to get Black men to get their cholesterol checked, their heart checked, because of the mistrust of doctors. It is hard to get a Black man to get a mental health screening. The reason why is because of the stigmatization that has already occurred in the mental health field. And that's not just for our doctors, that's for our psychologists, our social workers, our counselors, predominantly all of the human services field. And the reason why is because society has painted Black men as this threat, right? As this big threat that Black men are scary, Black men are a danger to society, Black men need to be dealt with or kept in their place. And when Black men have mental health episodes, society doesn't know how to deal with it. And so we, in the last couple of years, throughout COVID, when the isolation was happening, we started seeing like a lot of Black men going through depression, suicide ideation, and then a lot of Black men have started trying to utilize therapy. This was new because Black men were starting to openly talk about their mental health concerns. They were starting to openly talk about, I need to see a therapist. Society wasn't ready for that major shift because to them, Black men supposed to be strong. They ain't supposed to show emotion, they ain't supposed to cry. But here you are, you're starting to see this shift in the culture of Black men saying that I'm going to therapy, I need a therapist, I'm having some mental health concerns. I get depressed, I have suicide ideations, I cry sometimes. And society didn't know how to handle that because there was pretty much no template to go off of. We had one for Black women because Black women were considered the backbone of the community. We got one for Black women because Black women are considered to be emotional creatures. So we know how to deal with when Black women are crying, when they're going through stuff. Black men will talk about it. Black men, we had no template. It was, oh, this is new territory. So we gonna have to try to exactly how do we work with this population. But Black men also had that indoctrined fear of, we don't talk about our feelings. What happens in this house stays in this house. Um, why are you as a man your age or a man as big as you over here talking about you're depressed, talking about you want to kill yourself, like you need to go out there and be a man, don't no man do that. And then on top of that, we had clinicians who did not understand exactly how to treat. And the reason clinicians didn't know how to treat is because we have predominantly clinicians who are not of color. So the white clinicians, right, or the white doctors who are not used to an influx of African American males coming in to be seen for certain treatments or certain conditions, they don't have a rule book to go by. They're gonna go by what they generally use and what they generally know, but then they don't also have to understand there has to be more that we can do. Clinicians realize, and this goes back to my earlier answer, clinicians started to realize the DSM-5 was not a one-all fits all because they were getting these African American males who weren't fully meeting criteria. So you were having depression, but you were not meeting full criteria for depression. So I couldn't fully diagnose you. So I gotta go through the DSM-5 and see what else does your diagnosis fit. Oh, you don't fit bipolar 1. You don't fit bipolar 2. You don't have acute schizophrenia. You're not presenting with any type of systematic disorders that are meet the full criteria. You want to know why? Because the DSM-5 for you. So now I gotta find generalized depression disorder, right? Or generalized anxiety disorder. We don't know exactly what it is, but you meet criteria for it. So I'm just going to give you generalized anxiety disorder or generalized depression disorder because that's all I need. I don't need you to meet I don't need you to meet full criteria. You meet the minimum. So I can just give you that diagnosis, send you on your way, prescribe you some medication to treat it, and say that I did what I need to do. And that's where that fear comes from because I'm being underdiagnosed. There's something else there. Y'all don't know what it is because the rule book that you're used to, it doesn't have a category for me. It doesn't have a category for anybody not who is not white because that's easier to treat, right? But when somebody black come in and a black male like myself, oh, it doesn't fit. So now I got to figure out, can I just assign you a generalized criteria and pray to God that you never figure out that you are underdiagnosed.
That's right. Thank you so much. And that reminds me of the clinician who was talking about Black women and how they present differently. It kind of went viral. It's on the internet somewhere, but um, Black women can present differently when it comes to depression and anxiety. Number one, can you comment on that? Are you seeing that they're present, what ways are you seeing them present differently, and how do you feel personally about this kind of change in men, Black men, generationally, uh being more willing to acknowledge that there's mental health issues going on? How do you feel? What do you think of that?
So in the sense, and I'm gonna answer your first one and your second one because the second one is really gonna be interesting. So the first one, black women have always presented differently. So that's why it's always been, I want to say, easier to treat black women because black women are going to tell you what it is. They're not going to let you, and we can laugh about it, but black women are not going to let you just diagnose them. They're going to tell you, no, that's not it. We're going to get to the bottom of this. And if you can't do it, get somebody else who can do it. And I've seen this in numerous of my clients. I've had a client before, and she said, no, that's not what it is. She said, we're going to try this again. She telling me my job. And I'm like, yes, ma'am. Because she's an older black woman, and I was raised to respect everybody. But that I remember that this lady had to be about my grandma age. She said, no, that's not it. Let's look again. I said, yes, ma'am. And we went back over everything, and I had missed something. And I was like, okay, that's my fault. And that's something I should have been paying more attention to. And so, but the thing with black women is they are going to always present depression, anxiety, and then you also got to think about it. Postpartum depression, right? We're starting to hear a lot more about postpartum depression in women, only because we are starting influx. It's been known about postpartum depression, but it's been known in white women and white women. We're starting to hear more about how black women have been mistreated in the hospital system, which you already knew was common, and that during birth how they're overlooked and everything. But postpartum start really making is I want to say making headlines in the news when a black woman was starting to kill themselves or starting to hurt their children, or they were starting to alienate their husband from affection. And the reason why is because they didn't know what was going on, and it was postpartum depression, but nobody was diagnosing it at that time, right? Or nobody was fully, they were overlooking how it was being presented. Just like a heart attack presents differently in a woman than a mighty man, a stroke will present differently in a woman than it will in a man. Like everything was presenting differently. But black women are going to tell you when something is not right versus a black man, he's not going to tell you because he might not even know what's going on himself. Black women always know when something is wrong in their body. I don't know if it's because of the woman anatomy or it's because a woman are more attuned with their body than most men are. But there has never been a time that I have not worked with a black woman and she is not able to tell me exactly what's going on right down to the letter. And I'm like, that's right, because she knows. I may have my own clinical knowledge, but Who knows you better than yourself? And I've always seen how it presents differently. Mental health episodes, bipolar presents differently than it does in men, and I've seen it. I've had a client before who was bipolar schizo, but her boyfriend was bipolar. He was bipolar schizo with onset depression, but it presented differently. His presented in outbursts, anger outbursts, violence. Hers presented in her being withdrawn, her fully going numb, and you can see the difference on how they presented. But she was more inclined for therapy or for services. He was more resistant to therapy and more violent towards me. And you got to see those differences in our interactions. Now, to answer your second question about the influx of seeing Black men starting to get these services, right? It's a good feeling, and the reason why is because Black men are starting to show society that we are not just what media or society portrays us to be. This whole uber masculine, thugged out, hyper aggressive, image that the media portrays. And we all may laugh at it because of what we see on TV, but people really have categorized Black men as not having emotions. Like we're just supposed to just be here, right? We ain't supposed to smile, we ain't supposed to cry. We're just supposed to be here. That's all we here for. We're just here to move society along. Give y'all a couple of kids to keep the world moving and die. That's really what I look at. That's how I really how I look. We're born, we work, we give society a couple of kids, we die. That's how society, some people in society view Black men. And when Black men start finding that voice, they say, nah, that is not it. We have issues. We have trauma. We need to talk about it. Then that influx actually as a clinician makes me happy because we are starting to negate the trauma from our childhood and the trauma from our adulthood. And I always say that an unhealed child in a Black man is nothing but a broken man in adulthood. And the reason why I always say that is because if you had a traumatic childhood as a Black man, when you get older, that trauma that you didn't heal from, that you didn't address when you were a child, and when your parents, when they told you, when your the doctor told your parents to take you to therapy, and your mama sit there or your daddy sit there and say, "No, he's a man. He's going to get through this." That right there was your first failure. That's right there is when your parents failed you because they should have took that advice. And now they wondering why you 18, 19, you lashing out, you getting into all this mischief, you getting into all this judicial trouble is because you got all this trauma from your childhood that was never dealt with. And now we're here. Now we're back in this full circle moment. Then you have the Black men, and these are the Black men I see often. You got the Black men who understood the trauma. They understood that in their childhood they were raped, they were physically abused, they were emotionally abused, they were lack of affection from their mom. Their dad tried to toughen them up. They may not be super masculine. Doesn't mean that they're gay. They just don't have super masculine qualities because that's just it. They understood that. So they started to unpack that trauma as they got older. So it made it easier in adulthood that they weren't carrying that trauma over into anything else. And you see this in those therapy sessions because they're fully aware that I know I got issues. I know that mentally and emotionally and physically, I have a lot of trauma, but I have started to unpack it already. And then I saw therapy to allow me to unpack the rest because I knew I couldn't do it alone. Those are the Black men that we see always starting to see now with this shift in culture because they understand the damage, especially those Black fathers, and we're seeing an influx in Black fathers. Oh, I love it. Like active Black fathers, we are seeing an influx in the last couple of years. And we always talk about how the Black father is not in the household, how the Black father is the ruin of all Black families because single motherhood. And I always laugh at that because it takes two to tango. That means you and that man both lay down to make that baby. And if y'all didn't work out and he tried to see his children, but you keep his child away from him, it's really you who is perpetrating that stereotype versus the Black men who actually want to be in their child's life. They just don't want to be with the mother. That's different. But we're starting to see these Black fathers be aware of their mental health because they're seeing how their child rearing, right, and how their mental health as a child plays out into their role as a father figure. And then they start realizing I don't want to raise you how my father raised me or how my mother raised me because mentally it destroyed me. I'm not trying to do that with my child. And we're starting to see this big shift as well.
Thank you for going on about that. Very important and great to hear your actual opinion about that. And it is great to hear that more men are going on and being open to medical advice about mental health. All right, so our next section is called Following Doctor's Orders. We already talked to about this a little bit, but now I want to know the perspective from the Black clinician. A study from NYU Grossman School of Medicine found that patients with hypertension and symptoms of cardiovascular were more likely to adhere to the medical advice from doctors who are people of color, Black, Hispanic, and Asian. So we talked about the trouble with bias from non-people of color, specifically white physicians. That said, are you seeing this trend? Have you witnessed this? People more likely to receive the medical advice from people who are Black um, in the medical field. What are you seeing?
So we are seeing this trend, and let me tell you why we're seeing this trend. And I love this question, so thank you for it. So the reason why we're seeing this trend is because who do you trust, a white person or a Black person, right? And when we go back to, if you see everybody Black running, what do you start doing? You ain't answering no questions. You running with them. You don't know what's going on. You see Black people running, you just running right along with them because it's a sense of kinship, right? It's this sense of familiarity. Even though we may not be related, we all share the same skin color. And so what we know is that most of Black clinicians have our interests in heart, right? That means that they listen to us and they won't do anything to harm us. And it's like, let me give you a great example. It's like when an older Black woman calls you baby, kind of warm feeling, right? Yeah, it gives you that warm feeling because you don't even know this woman from a can of paint. You just out in public doing some shopping. She said, "You okay, baby?" And she be like, "Everything gonna be okay." And she just pets you. This woman don't know you at all, but you get the warmest feeling. That's the same way with Black clinicians. What we're seeing is that our clients are happier when they are seeing somebody of color. And the reason I say that is because we trust them and they more explain the medication aspect as well. I often see in these areas that doctors do not fully explain medications to Black clients versus their white clients. And so what happened is a Black they say, "I'm going to prescribe you this medication. This is what it's for." But they won't kind of go into any of the details because they don't tell you the side effects. They don't tell you exactly what if it might make you sterile, if it might cause other issues, if it might affect your kidneys. But with white clients, they go into more details, and I've noticed this often. And so with our Black clients, they're more happier to see a Black physician because we get those details, we get that in-depth conversation, and it's not like, and sometimes it's not like I'm in a medical visit. It's like I'm catching up with my smarter cousin who went to medical school, and they explaining everything to me in a way that I understand. Because we also got to look at health illiteracy as well. And I talked about this earlier that in the Black community, especially our older Black elders, our grandparents, our great grandparents who did not have this much access to health care or to medical care in general, that they have to have everything explained to them in a way that they understand on their literacy level. So I think that's why it's so important. And Black men in general who don't really go to the doctor, it makes them happier because they know that if I have a Black doctor, a Black male doctor, that I know that there's somebody that I can be honest with them, and they truly will take time. When I got my first Black doctor, and I can laugh at this now, my first Black doctor is when I was a child, and I had that same Black doctor from to I left for until I went to high school because he retired. Then I had a Black female doctor from all the way up from high school until end of grad school because she seen me all the way up until I finished school. She's like, usually I see only pediatrics. He said, but I see my students who are in college up until they finish college. So she seen me all the way up until I finished grad school. When it was time for me to work and I had to find a doctor, I told my mom, I said, I want a black doctor. I don't care if they male or female, because I had went to a white doctor before, did not like my experience. I felt rushed. I felt like they really weren't listening. It was just like, let me check your vitals. What are you here for? This, that, and the third. And I feel like I was being rushed. So I was like, yeah, I don't like that. And I told my mom, I said, my mom was like, you need to get a primary care provider. I said, well, I need somebody who's black. Found a black doctor, a black female doctor. And when we on our visits, it is one of the most comfortable visits ever, because she understood when my first visit. She said, I know you're uncomfortable. She said, but I promise that I'm going to make this easy, because I had told her my apprehensions of going to the doctor. I had on myself, because I was like, most times the doctors rush me. My visits are very fast. He said, we don't do that here. She said, I give you the full amount of time, and we usually go over. And she said, that is fine. And so I've had this doctor, I want to say about 4 years now, and have not left. And every time I go to my visits, he said, catch me up. What's been going on in your personal life? How you feeling health wise? Let's make sure that we're looking at everything, because he's like, I'll make sure that we're not missing anything. And that visit is always so comfortable to me that it feels like that I'm just talking, like I said, to an older cousin, because that's how she makes the office feel. And I love that feeling.
Wonderful. Yes, I love that. Just your older, smarter cousin. That makes everything just more comfortable. I love that. And good to hear that you've been able to find good black doctors as well. All right, let's move on. I did want to talk about some possible solutions to these issues. Black psychologists make up about 4% of the doctor level psychology workforce. That is according to a 2018 study and data set. So when we talk about solutions to these issues, um, do you think there is one a solution to finding more, or finding or using more black therapists or therapists of color? Do you think it's necessary? We already touched on, the just going to like the physical doctor, but when we talk specifically about mental health, do you think it's necessary to only talk to black people? Should it be the goal for us? And is it a practical goal, knowing that we make up about 13% of the US population?
For solutions, I think what it is, and I'm just gonna go in this random order. So just follow me here. When we're looking at solutions and we're trying to think about how do we engage African Americans, or how do we engage African American males, because that's the subject of our topic today. One, we need to reorganize the DSM-5 and to include inclusive diagnoses. And what that means is that these diagnoses are inclusive to those who are non-white. And that would allow clinicians, not only of color, but not of color, to understand how to work with these populations. Two, even though there's only 13%, per the data, it is still realistic to have a network of mental health providers, clinicians, therapists, within each state, or by each state and by each city. It just depends on how you want to do it, and that will allow as a good resource for Black people who want somebody who look like them in the therapeutic setting. When I look for a therapist, or when I was looking for a therapist, I went to a Black woman. You won't see too many Black male therapists. It's a rare set of us. And so you'll see a lot of Black women as therapists. And so I went to a Black woman therapist, and it was one of the best experiences I ever had, because again, I was comfortable. I felt seen, I felt heard, and as a Black man, she made sure that I had that open space as well. And that is going one of the biggest challenges. I'm not going to say hurdles, but one of the biggest challenges, that as Black men, we have to feel comfortable in the therapeutic setting, or else we will not open up. We will kind of withdraw back into ourselves. And that is detrimental to our growth mentally, emotionally. That is very detrimental. And so when we have a network of clinicians and we're able to kind of disseminate this information out to the masses, then we are kind of fixing the solution, but we're also not fully, because there's still more work to be done. There has to be more access, for Black men to get mental health care without these barriers in place of assurance, without the fear of stigmatization, without the fear of racism. There has to be more work put into that. You know, I think I feel more comfortable walking into a room of Black people than I feel walking into a room of white people. And again, it's that innate fear, that innate that we are so accustomed to, that we're not allowed to be ourselves in these settings. Versus when we're in a setting of our own folk, our kinfolk, then that kind of fear of racism goes away. But in the same breath, we also have to be fully aware that we won't be able to treat everybody. And it's one of the saddest things as clinicians that we kind of have to understand, is that we sometimes will have Black men who weren't able to treat because the trauma or the disorder is so severe. We do not have a good solution on how to treat it. We can only give you what we know, and hope from there that it would help just a little bit. And that, because that requires more research, right? For instance, have you ever seen a Black man who returns from the military suffering from PTSD, right? And I've seen that before. And every type of treatment, you try to get them into the care, and nothing helps. It's because mentally they're so far gone that we can't reach them inside. And you will have those type of cases, and that's because more research is needed on how to treat it. We don't have it. When you look at the research on Black men in therapy, Black men utilizing therapeutic resources, that information is scarce. When I was writing my doctor, my when I was getting my doctorate, my research was on unaddressed mental health in Black men. That research was scarce. I had articles that were spanning 10 to 13 years to pull from, with no relevant data. So I was pulling from different data sets and different trends, and making, as you, in my research, what we saw was the biggest gap, because we saw the biggest gap in therapeutic solutions and approaches for Black men. We saw the biggest gap in how to advocate for Black men in therapy. We saw the biggest gap in how to entice Black men into therapy as well. And those were the biggest gaps we seen. And then we also seen the high rise of suicidal ideation and depression, but lack of treatment modalities as well. And those four things are very big, because if we can't address all four of those in one setting, we're already halfway to failing that population.
Very important information there. And for my last question today, it is focusing on what are Black Americans' recent experiences with the U.S. healthcare system, according to a study. So that study in 2021 said that they are mainly positive. About 6 in 10 Black adults, 61%, say the care they received most recently was excellent or very good. Another 25 said good. And half say their out of pocket cost for that care was about what is fair. Um, I do want to note that it said still 55% reported that they did have some kind of negative experience in the healthcare system. Do you agree with these findings? Are you seeing more positive reactions from people?
So
So
I do
I
agree
do
with
agree
the
with
findings.
findings.
So let me tell you why. The reason I agree with these findings is because white clinicians and therapists and counselors have got some sense about themselves. And I'm very southern, so it's a compliment. But in the same regard, it's also observation. They have got some sense about themselves, because they have seen, like I said, they've seen this influx, right? And so they've also seen in the news the treatment of people of color, specifically Black men, in the treatment of Black men in the media, police brutality, and they've heard the horror stories. Nobody wants to be on the side of a lawsuit. and nobody wants to be on the side of negative publicity for any for the therapeutic company, for the hospital. They don't want to have to deal with anything. And you seen it, and if you notice, a lot of people have been about diversity, equity, and exclusion lately, right? DEI. And so a lot of people are starting to utilize DEI because they understand that if we don't correct this now, we're going to find ourselves either bankrupt or in a lawsuit for racism, for malpractice, or whatever category it falls under. And so those findings are correct. Now, I'm not going to say that 55% is wrong, because there are still negative experiences in the healthcare system to this day. And those experiences that we see are because you have people in the healthcare system who still have these, I want to say, these old ideologies of how to treat Black patients. And then when you start, and I think the reason why is because we have people who are our grandparents' age, people who are our great grandparents' age, and people who are also our parents' age, depending on what age your parents are. So over the age of 50, I say, for most people, who are still in the healthcare system. And so when they were learning medicine, or when they were practicing medicine, we have to look at exactly what type of time it was. So, say for instance, if you have an older white doctor who's been practicing medicine since the 1980s, or since the 1970s, if we want to be honest about it, he still may have this certain ideology about working with Black patients. Versus if you have a new doctor, a new nurse, a new CNA, a new social worker clinician who, like we'll say, within the last 10 to 15 years, who's came out of school, they are more aware of what's impacting the healthcare systems. They are more aware of the latent racism that underlines the U.S. healthcare system, the U.S. Therapy system as well, and so they know exactly how to navigate it. They know exactly what to look for to make sure that they're not on the receiving end of backlash, or the receiving end of anything that could potentially ruin them as a clinician working with people of color. And so I think in the next probably 10 to 15 years, we're going to see this trend, and we're going to see a increase in this trend of Black clients saying that their healthcare experience has been better. And I think it's because we're starting to get these new doctors in, and we're starting to see an influx of doctors of color, clinicians of color. And as we're seeing this influx, we're starting to see that these experiences are getting better, because again, we're seeing more of us.
Great. Yes, they know to keep it together. Basically. Thank you so much for that. That is the end of our show. Is there anything else you'd like to share, Dr. Cloud, on this topic that you didn't get to talk about?
I think the
I
only
think
thing
the
that
only thing that
is
is
that
that
health is very beneficial to us. And one thing I didn't get to talk about, and one thing I want to drive home, is that when you have the chance to, or when you are going into these healthcare settings, these therapeutic settings, and there is not a clinician of color on the team or on staff, treat that as your first red flag. And I hate to say that, it's because if you have no type of person on your team who can speak to the diverse population that you're working with, and if everybody on that team is white, then that treatment model is already biased and skewed. I would rather walk into a doctor's office or a clinician office and see four white people and one Black clinician. That means that I at least know that somebody has input for me, by me. But if everybody on that in that office or in that doctor's office is all white, and you never had, or there's nobody there who works for you that looks like me, that is the first red flag, and lets me know that you would not work well with me, and that I need to find somebody else. So always be aware of that as well, that you should always have a clinician office or a doctor's office with somebody that looks like you on staff, because you will always have an advocate in your corner if things do not go right. And that's all I got to say.
All right. Thank you so much. It has been an absolute pleasure. I want to encourage everyone to educate yourselves about this topic. And if you're a Black man watching, we hope this was able to encourage you in some way and bring some insight to you. Dr. Cloud, Thank you once again. I did want to ask you to announce your social media tags or websites or the services you provide to the folks watching.
So everybody, thank you again for staying with us through our technical difficulties. So my Instagram name is Dr. Cloud underscore Southern Bow. It's a play on words to my Southern heritage. You can always find me on LinkedIn at the Quavion Cloud, or just put in Cloud. I promise you I'll pop up. Cloud is not a common last name. If you, I also do mental health consultations for organizations that want to work with Black men as well, or they want to figure out how to diversify their portfolio to attract Black male clients to their agency as well. So you're always more than welcome to reach out to me for a consultation about that as well. Um, and then I also do have a Black Men Need Love Too, which is one of my mental health journals. And it's geared for Black men, written by Black men. And it pretty much has a lot of therapeutic prompts in there for Black men to kind of help them through their therapeutic journey as well. And that's pretty much all I do. That's me.
All right. Thank you so much. Again, it has been such a pleasure to everyone. Thank you for tuning in to Black Mental Health Matters. To support our show, please visit bmhm.org. And for the latest conversations on Black mental health, please follow us on all social media platforms. Thank you and see you next week.